Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Today is the first day of the Phase 4 of the MCO, and it began with a slight easing of restrictions. Two people from the same household can now go out to purchase essential items. This must come as a relief, I'm sure, to many, especially to single parents. Anecdotally, I've heard of single mums and dads getting told off for bringing their children to the grocers, and some have really struggled without any support. So hopefully this brings some relief. Don't you think, Sharaad?
Absolutely, and I think we're looking forward to a time when more relaxation happens and that allows people to make choices for themselves, but also with the full knowledge of what it would mean to let their guard down and not consider all that they need to when they go out or when they are in more crowded spaces. I think that is something that, again, we hope that the public education dimension of this campaign really gets internalized, the idea of social distancing.
Because it really does require the buy-in of the public. It's not just about enforcement of the MCO. We must really live this. I'm curious to know how both must be of the same family, living in the same residence, so whether you're going to have to prove that with some kind of address on your IC if you get stopped at a roadblock. Yeah,
I mean, I'm hoping the police and the army personnel that are at roadblocks use their discretion and also err on the side of generosity. I mean, if you are going to treat everybody as a suspect, as somebody potentially wanting to violate the rules of the MCO, then you only create the kind of conditions that will end up filling up those MCO prisons. And what's going to happen with that when the MCO ends?
Well, today at the daily briefing, Director General of Health, Datuk Nur Hisham Abdullah, said that the government is now considering relaxing non-close contact exercise soon. And this is, of course, provided that we observe social distancing and there are no mass gatherings. So if you look at Singapore, even though there is what the government calls the circuit breaker, the lockdown, there is some kind of leeway. Joggers are still allowed to run, provided that they maintain about, I think, a 10-meter distance from other people. Perhaps now Malaysia is looking at those types of easing conditions.
Yeah, so there's the government, whether the government is considering. The other thing is whether people are ready. And again, we come back to the same point. I mean, you can go to a park and you can congregate in spots in a park if you chose to do so. I mean, or you can, acting on the basis of some self-preservation and also what is good for your community, you then make those decisions for yourself. Right? And of course, I know that a lot of people will be wondering, when the gyms are going to be open. Many people, not that many fitness freaks out there, but I know that those who aren't allowed to go to their gyms, this MCO has been a real dampener on their, fitness routine.
Well, looking at Sarawak, for instance, they are saying that they will decide what industries to open up and when, according to the situation locally. So they say that they know the situation best in Sarawak, and they will make sure that whatever decisions they come to, they will put Sarawakians as a top priority. So this is quite interesting because there were some economic projects that MITI had approved to be able to operate in Sarawak, which the territory says are in red zones. That means the number of COVID cases are above 40. So Sarawak is now re-looking these projects and saying, well, we will then decide, we are the final say as to whether it is appropriate to operate or to open up in Sarawak's environment.
What's interesting, Melissa, when we spoke to the Chief Minister of Sabah last week, Shafi Abdal, he made pretty much the same point. We asked him, what were the legal or constitutional issues around this? We know that the law that was invoked for the MCO, the Prevention and Control of Infectious Diseases Act 1988, you know, that's a national law, federal law. But the, you know, what if you remember what Shafi Abdal said was that yes, there is this law, but you know, we know the ground situation better, and it does, you know, bear thinking about the federal nature of the state, of the country, and also the way in which power is or isn't devolved in our country, and whether the way we have structured governance is beneficial, has been beneficial in these past couple of weeks dealing with the COVID crisis, or in fact is ultimately a barrier to better operationalize the principles that we are now seeing. So there can be more sensitivity to local conditions.
Well, another point we would like you to consider tonight is the argument raised in the opinion piece by Star Media Group's advisor, Datuk Sri Wong Chun Wai. It was titled, "We Have Become Poorer, Live With It," and it came out on Monday. In it, he wrote, and I quote, "The situation is far worse when workers refuse to accept pay cuts by ignoring calls to make voluntary sacrifices because they are only making it harder for their employers to sustain their businesses. And the moral of the story is, it's better to hold on to our jobs with lesser pay than it is to accelerate the end of days of our companies," end quote. This is certainly very interesting to me, Sharaad. What did you think?
Well, Melissa, you know, it's always difficult to take advice from millionaires and billionaires.
About pay cuts?
About pay cuts, or about tightening, or living simpler lives. I mean, but that aside, I think Chun Wai does seem to have some important points to make, especially with which is what the bulk of our economy is run on. The small and medium-sized enterprises don't have the kind of wiggle room to perhaps, you know, absorb the costs of the MCO or, in fact, the recession that is looming.
I completely understand that. Perhaps, you know, with the smaller, with SMEs, micro SMEs, it's more difficult to say don't take a pay cut. I get that, but I'm wondering whether this advice can be kind of applied across the board, particularly as that statement, you know, the situation is made far worse when workers refuse to accept pay cuts by ignoring calls to make voluntary sacrifices. How do we digest this? I mean, who takes a pay cut? Are we looking at perhaps, you know, the top tier of management taking a more significant pay cut than the rest of the company? Perhaps if you look up and you see your bosses taking a significant pay cut, then you might then be a bit more well disposed to taking less money home every month yourself.
Know, we've had, you know, CEOs of big companies asking for bailouts or asking for public monies to be spent. The question people were asking, well, you know, you made profits. The profits you took on for yourself. You build your big palatial homes. You live lavish lives. Are you going to downsize in this? Should you be plowing back the profits that you made back into the company and saving the jobs that you say and the livelihoods of the individuals you say you're concerned about? I mean, that is ultimately a trust issue.
Yes.
And I don't know how many CEOs and managers build trust with their workers, sharing financial information so that when they ask for a sacrifice, people believe that this is something they're in together with.
But also during good times, those good time gains shared accordingly so that you can also ask for some belt tightening when it's bad times. All right, we're going to take a quick break, and after this we'll take a look at Malaysia's targeted testing approach. Can we lift the MCO and open up the economy without adopting mass testing? We'll speak to a public health medicine specialist in just a few minutes. Stay tuned. Hello, if you've just joined us, you're watching Consider This. I'm Melisa Idris, with me, Sharaad Kuttan. The Ministry of Health had announced very early in the fight against the pandemic that Malaysia would take a targeted testing approach so as to use our medical resources optimally. However, this approach has been questioned by some medical practitioners, especially in seeing the success of mass testing in countries like South Korea. In targeted testing, the tests are conducted based on the location of COVID-19 hotspots and for high-risk groups only. One epidemiologist who has supported targeted testing over mass testing is Dr. Nirmala Pathy, public health medicine specialist and associate professor of epidemiology at the Faculty of Medicine in University of Malaya. Dr. Nirmala, hello, good evening. Thank you so much for coming on the show.
Hi, good evening.
So, the WHO, their key message has always been test, test, test. But you wrote an opinion piece that argued that targeted testing is actually better for Malaysia compared to mass testing. Can you help us understand why you argue that?
Well, one of the reasons why I said that in my opinion piece was because test implies that we are going to cast our net wide. And for a country like Malaysia, testing is expensive to begin with, even for high-income countries. And when we are going out with the approach of test, and cast a wide net, it's going to be really expensive. It's going to be a very expensive affair. And at that point when I was saying about, we can't go that way, one is we are talking about the cost, but also our testing capacity. We were kind of limited. So we have to be very wise and choose what we can do rather than going along with the mainstream of people, because all that really depends on the resource level of the country.
Nirmala, considering the WHO has as its remit the entire world, developing countries, advanced countries in terms of their economies, why do you think they insist on this one-size-fits-all type of approach? Surely they are aware of the different capacities of the countries around the world.
Yes, it's true. It all started with this mantra that WHO was rolling out of this test. And it was really like something that quickly picked up and everybody was starting to use the mantra. Mm-hmm. But the problem is that when we are talking about mass testing, and a lot of times we like to refer to South Korea, but when we say mass testing means we are testing a lot of people, testing people irrespective of whether they have risk or not. And a single point, and then we also talk about testing, and when we talk about testing, really, it's about a single point time testing. And a single test will not be useful if you think about it, because yes, we can pick up people who are positive, but people who are negative, who are tested negative, they are labeled as not having the infection, but at any point they can get infected from the community. So what we are doing is counterintuitive, if you think about, the bigger picture. So even in South Korea, so in order for us to say test, what it really means is if we really truly want to go along that path, it must be repeated testing. So we test a population, and from time to time we test them again and again to make sure that there is no new infection, because people live and they move around. So although they may test negative a single point of time, they can move to another place and come back infected. And if we only do a wide single point of testing, we are going to miss this new infection in people who have tested negative previously. Okay. So which is why I think that if we want to go along the road of mass testing, and if we have the money, we have the resources, then it should be repeated testing. So that's, again, it's not something that we can do. It's not pragmatic for a country like Malaysia.
Okay, all right. So with mass testing, you're saying it needs to be repeated testing, not just a single point time testing. But the approach that Malaysia has taken in terms of targeted testing, the question is whether we're testing those targeted cases, that there are enough tests. Last week, I believe the Ministry of Health said that they had achieved initial targets test of about 16,000 odd cases, tests per day. They're seeking to step up the testing capacity to 22,000 by next week. That is what they're hoping to achieve. Now, is that enough for targeted testing?
We are heading the right way. We are heading the right way because what we have done in the past, of course, in the early part of the pandemic in Malaysia, we were quite restrictive with our criteria. So in that era, when we were restrictive, we were missing some cases. But right now, apart from increasing the testing capacities, we are also loosening up our criteria. So we are becoming more inclusive. So which means that in the past, we wanted people to have a travel history. We wanted them to have, or we have a contact with the person who is positive. So right now, we are also relaxing this. So along with that increasing capacity and loosening so that we are casting our net a bit wider, I think we are heading the right path.
One of the questions I think that comes to mind often is the way in which the public understands the numbers that are trotted out on almost a daily basis. Yes. One of them has to do with infection rates, right? So how many people are infected? But isn't that also a function of how many tests you roll out? The more tests you roll out, chances are you'll find more people at least positive with the COVID, not necessarily symptomatic. So should we take the numbers of infections seriously? Should that be a criterion for how we dial down or dial up the MCO?
I will split the question into two, right? So first, we are talking about when we look at the number of cases, are we really talking about the real number of cases, or are we really reflecting our testing capacity? So you were spot on when you said, you know, for example, when people talk about comparing Malaysia versus our neighbor Singapore, and we see that Singapore has been reporting a lot of, you know, a massive increase in number of cases, it directly relates to their testing because they have stepped up testing and we have not caught up with them. So if we were to test as vigorously as Singapore, we will have higher number of cases. But that is not really what we want to do because it's not just about identifying cases. Because what we really would want to do is identifying those with moderate to severe infections so that they can be treated appropriately so that we can bring down our number of deaths, for instance. So it cannot be tied directly to number of cases. And then going back to your question, I believe you asked whether, I just want to confirm, you asked whether we can link testing capacity with lifting of MCO. Is that right?
Yeah, the infection rate with the lifting of the MCO.
Okay, infection rate, that's treading on dangerous waters, right? Because what we are doing is, I think the message here that I would like to clearly, stress out is we should not just rely on testing and positive rates to lift MCO. There are a lot of other factors that we need to look at. So in the beginning, we executed the MCO, and the reason was we want to delay the spread of the disease and flatten the curve. Yes, we have somewhat reached that point, but right now, it's too soon to lift the MCO. So we cannot just for a short period of time, we see the numbers are coming down, and then we say that, because the number of cases are low, it's time to lift the MCO. I know there are a lot of economic arguments, social arguments, but from an epidemiological point of view, it can be very dangerous. And it's a very tough balancing act to just, say that we can relate infection rates and quickly think about lifting the MCO. There needs to be other measures that need to be put in place.
All right. Dr. Nirmala, very interesting points there. I'm going to pick up this conversation in just a couple of minutes. We're going to take a quick break, but stay tuned to consider this as we continue our conversation about Malaysia's testing approach in just a few minutes. We'll be right back. Thank you for staying with us on Consider This. Melisa and Sharaad here this evening. Now we're continuing our conversation about Malaysia's testing capacity with Dr. Nirmala Pathy, public health medicine specialist with University Malaya. Dr. Nirmala, before the break, you mentioned that just using infection rate alone is not enough to decide when to lift the MCO. In fact, you say that as an epidemiologist, it's too soon to lift the MCO. If it's not the infection rate, then, Dr. Nirmala, what should it be based on?
We need to make sure that the infection rates have come down. Yes, that's one of the criteria. But we must also look at the readiness. So the Director General of Health has already outlined what WHO has said before in terms of the readiness that we are talking about. But let me also scale back, because I think while my topic is talking about targeted testing and so on, I think we cannot undermine the importance of physical distancing measures, for instance. So if we think about lifting the MCO, we need to put into consideration from several aspects. So from the social responsibility aspect that we expect from our population, we need to make sure that the public are very clear about physical distancing, are they well aware. And they have had some sort of training because over the past few weeks, few months, we have been on MCO. So we need to ensure that the public will go on because we don't want to let them have this false sense of security or early celebration, because I would like to use those words because it seems that there is a trend going on in the media that people are seeing that this lowering of infection rates as a sign of success. Yes, it's a sign of success, but it's too early to celebrate. So we have to make sure that the public keep up with their social responsibility. So physical distancing, hand hygiene, and avoiding of crowded spaces. And this last, avoiding of crowded spaces, is so crucial because now we are in the month of Ramadan. And Ramadan is a great game changer. I've mentioned this before. And because we have Muslims and non-Muslims celebrating Ramadan, so even the non-Muslims, so we are going to have people who would be inclined to attend opening, like buka puasa and so on. So from the social responsibility aspect, we must ensure that the public keep on doing what is right from a social aspect. But also from the government sectors, because we are now talking about returning to work and businesses opening up. So we must ensure that the right protocols are in place. And this right protocols not only talks about returning to work, but also use of public transport, and we are also advocating that people wear masks. And some of them may have to wear more than just masks. They might have to wear a shield,
a face shield.
We must make sure that protocols are in place to ensure that these people who are using these protective equipment like masks and so on, whether they know how to keep them clean, how to maintain hygiene. So these are things that at systems level from the government sectors and the employer side, we must make sure that these protocols are developed. I have heard that there are many protocols being developed, but it's not enough that it's just developed, but we also need engagement. So people who are going to be subjected to those protocols, do they understand it? Is there any, is there going to be a challenge implementing these protocols?
Right.
These are things that will require some amount of time to think and may require a week or so to adjust. So,
Dr. Nirmala, just sorry to interrupt you there, but can we talk a little, because time's running out, can we talk a little bit about the high-risk group? Because one of the concerns is that many of us might be asymptomatic, might feel fine, and therefore endanger other people. And I'm thinking about, older folk and so on, all that's been in the media about who is the high risk. But do we actually know how to calibrate what high risk is? I mean, do you have to have some chronic disease, or could you just be a healthy older person? Are you also in the high risk group? How do we understand that notion of protecting people in high risk groups?
Okay, thank you for the question. When we talk about high risk, right, the evidence has been changing. So right in the beginning, we thought that people who are elderly are at risk. And then with new evidence, scientific evidence, when I say, and we know that people who have diabetes or hypertension, they are at risk. And so as the evidence is building up, we need to be more inclusive. So that was what I was referring before. And also in the past, when we were talking about testing, we were talking only about people with symptoms. And now you are bringing in about people who are asymptomatic. So we will never be able to address people who are asymptomatic completely unless we perform mass testing and we do it repeatedly. That's for sure. But even when we do mass testing and repeatedly, there's always a risk of missing people who are having asymptomatic infections. And the fear is not so much about people who are asymptomatic, but because they are going to infect another person. And for that, we don't need testing alone. Physical distancing measures, hand hygiene, and proper education, these are things that can prevent an asymptomatic person from infecting a vulnerable person.
Right.
So that's why I was harping on the protocols just now and social responsibility and so on. So testing is not a standalone strategy, but it needs to go hand in hand with all other public health measures. And with that, we will be able to deal with these people who are asymptomatic, who goes walking around undetected in the population.
Very good. Thank you so much, Dr. Nirmala. That was a very informative, very enlightening conversation. We really appreciate your time, but unfortunately, that's all the time we have on this episode of Consider This. We must have you back for a longer conversation. I'm Melisa Idris, with me, Sharaad Kuttan, signing off for tonight. Thank you so much for watching, and have a great evening, folks.